Wonderful. Well, welcome everyone. My name is Ellie Mason. I'm a recovery friendly advisor with New Hampshire Governor's Recovery Friendly Workplace Initiative administered by Granite United Way. And that administered by Granite United Way is a key word today in our presentation. We are so grateful to have Granite United Way's 211 here with us to tell folks about what they offer as support to anyone in the state. We have Heather Pacheco, the director of 211, and Jackie, the assistant director. So I appreciate both of you being here. Um, and I'm going to turn it over to them, but I just want to mention that this training came out of some questions we were hearing from businesses around what else can I do? We have a recovery friendly culture, we have a supportive workplace, but our employees are needing more than that. Given the times that we're living through. So we thought that it would be a great time to have 211 come in and talk about how they can help. So I will turn it over to Jackie and Heather.
Thank you, Ellie. Hi, everyone. I am Heather Pacheco. I'm director of 211 New Hampshire, and I am very grateful to be here today. Thank you to Recovery Friendly Workplace for having us. I'm really excited to have this opportunity to share with you a little bit about what 211 is and what we do, and just talk about how we might be a resource that you can share with your employees and your teams. So at 211, I have a fabulous team of people that is working to staff our call center and support people across the state of New Hampshire to help them find resources for a variety of basic needs concerns. So today, Jackie and I are going to talk about a little bit about what we're seeing, how people use our services, what it looks like when people call us, some of our call data, and how we can support you in your work and help support your employees. But before we get into it, I will pass it over to Jackie to introduce herself.
Good afternoon. Again, my name is Jackie Stone, Assistant Director of 211. So I oversee the 211 database and the team that manages it. Our team works closely with different agencies to ensure that we are providing callers with accurate, comprehensive information on the programs and services that are listed in our system. But before I get too much into the details of the database, Heather, do you want to start us off and give a brief overview of 211 and introduce our team?
Absolutely. So you may be familiar with 211, you may not be, but I'll kind of give a high level overview of who we are and what we do. We are, like Recovery Friendly Workplace, an initiative of Granite United Way. We are a nonprofit, community focused information and referral service. Our services are free and in most cases confidential. It's available statewide, and our services are really designed to help people navigate challenges so that they don't have to figure things out alone. We're available 24/7 by phone. We also have a website with some search capabilities, but I always like to mention when speaking about the website that we do prefer that people call us just because we like to have a conversation and try to understand what's going on so that we can potentially identify some co-occurring needs or other resources that people might not be aware of if they're trying to search our website on their own. So 211, as I mentioned, we're an information and referral service. We don't provide any direct services. Our role is to connect people to existing community programs and resources. We assess needs, identify appropriate resources and referrals, and we guide callers to their next steps. So some of the things that we help people locate resources for include referrals for housing and shelter supports, food access, substance use treatment and supports, crisis services and mental health services, utility payment assistance and rent payment assistance, healthcare, transportation, family supports and services, and so much more. We are there to guide people through these complex systems of care in our state and help them understand their options that are available to them in their communities. We have a small team. We have 8 information and referral specialists on our phones each day. And each of them is trained in active listening, de-escalation, and navigation. So they are there to listen, talk through situations, and explore options with callers. And this group is the most compassionate and helpful group of people that I've ever had the pleasure of working with. They always respond with empathy, and they strive to make sure that the information that they're sharing is accurate, and that all of their callers feel supported and welcomed and encouraged to and empowered to move forward. We also have a resource database team that works behind the scenes and keeps those resources that we're giving to our callers up to date, ensuring that our call center specialists have reliable information. And now I'll pass it over to Jackie to sort of talk through some of that about our database, how we work with community partners, and how the information flows between those organizations in 211.
Thanks, Heather. Yeah, so I briefly mentioned the resource database earlier. So now I'll give you a little bit of background on it and how we operate. So our database currently contains over 4,000 individual agencies across the state of New Hampshire. Every agency gets vetted by our resource department. So we make sure that they're legitimate, they're not predatory, and they're providing services that truly support New Hampshire residents. What makes our database unique is that all the information comes directly from the agencies themselves. So we're not pulling information from Google, Bing, or any other outside sources. We also list and share program information with callers. So things like eligibility requirements, if they have to make an appointment, or complete an online form, whatever the details are, we share these with callers so that we're not sending them to apply for programs that they're not eligible for. We don't want to put agencies in the position of having to turn people away. So with that being said, I know someone had a question about their organization getting referrals from people outside of their town and if there's a way to correct this. So there is. Communication with our agencies is a vital part of our work. Since the information comes directly from them, it's important for agencies to keep their information updated and contact us if they're having any issues or situations like that. So we are able to geographically link specific towns, counties, states, whatever it is to each program, so that only individuals within those zip codes will see that program as an option, whether they're searching on the website or they're calling in to our staff. So we reach out annually to ask agencies to review their listings, update their programs, and enter in their service areas, which would make it so that we can link those areas to your programs. You can always contact us with questions. We'll review your listing. We'll talk you through it. We'll work with you, make sure everything is accurate. So now that you have a little bit of a sense of what 211 does and how the database supports the work, Heather, do you want to talk about some of our contracts and partners that we work with across the state?
Absolutely. So we work with a wide range of partners across New Hampshire. The logos on your screen represent a very small portion, but these are some of our larger, more well-known partnerships. As I mentioned earlier, we operate under Granite United Way, but we also support several state operated programs. More notably would be the Doorway. So the Doorway is part of the state's opioid response, and it provides 24/7 access to substance use services and supports. Anyone in the state at any time of day or night, holidays, weekends, can call 211 and ask to be connected to the Doorway, or identify that they heard they could call us for treatment options, or just somehow communicate that they would like help with substance use or alcohol use disorder. And we will get them connected right over to their local Doorway. We'll get a live clinician on the line for them, minimal hold time involved in that. We're going to make them feel welcome to call, help. We try to emphasize that we're glad that they called, and get them promptly connected to the help that they want while they're in that moment of wanting that support. We also partner with other emergency services providers, including 988 and the New Hampshire Rapid Response Access Point for mental health crises. We have a backline to New Hampshire 911 if we are ever in a situation where we've identified that a call needs an urgent emergency response. We can get right through to 911 and get that person help in that moment. We also partner with domestic and intimate partner violence networks across the state so that we can help people in those situations find the help that they need quickly. And we always respond to any urgent situation with compassion and urgency. We're always trying to assess for safety and keeping that on the forefront all the time. We work closely with the Department of Health and Human Services and act as the state's homeless hotline. So anyone experiencing homelessness or at risk of experiencing homelessness can call 211 for resources and referrals. We make referrals to street outreach organizations, get folks connected to shelters and other weather provided resources. And we're there 24/7 for that purpose as well. Another program that we work, a lot of our call volume goes towards is the IRS VITA program. VITA stands for Volunteer Income Tax Assistance. And each year, 211 helps to schedule tens of thousands of appointments for New Hampshire residents to have their taxes prepared for free. And this helps folks ensure that they're having their taxes done accurately. It helps to maximize their refunds, which contributes to financial stability in our communities. We also partner with the New Hampshire Aging and Disability Resource Centers. We share resource information, we make cross referrals to one another, and we keep in close contact so we can ensure that we're making appropriate referrals and getting folks connected to the supports and services that they offer. We are also part of the state's emergency response networks, and we work closely with Homeland Security, Emergency Management, and the Department of Safety to respond to weather and public health emergencies. You may remember us as acting as the state's COVID hotline during the COVID pandemic. We experienced a significant increase in our call volume and awareness of 211 during the pandemic. And our call volume, while it has dropped since we were the COVID hotline, it still remains high. And we've really tried to rise to the occasion by bolstering training to ensure that our staff can really help folks effectively address their needs. So these kind of cover some of our more notable partnerships. And I will pass it over to Jackie now to talk about some of those smaller community-based partnerships and how collaboration works so that we connect callers to local resources where they live.
Yeah, so those formal partnerships Heather talked about are a vital part of our work, but they only take up a portion of the types of calls that we handle each day. So many of the people we assist are connected to organizations that aren't official partners. Some of the examples you can see here is just a small sample of different organizations in our database. So we might refer someone to a community action partnership for utility assistance or a town welfare office for financial assistance. We have resources that provide support for families, transportation, educational resources. Our team does more than just provide these phone numbers, though. They have conversations with people. And depending on the individual situation, we match them with services that best fit their needs. So the variety is really what allows us to support callers in a meaningful and effective way. So we receive thousands of calls each year, make referrals for many different needs. Heather will now go over the data from last year and give you a little bit of a clearer picture of what those needs are.
Thanks, Jackie. So on your screen now, you're seeing some of our data from 2024. This was a year, January through December. We received around 67,000 calls that year, 91,000 visits to our website. And you'll notice a couple lines down that we also made 109,000 referrals. So what that means is on those 67,000 calls that we received, we did not just provide one phone number. We didn't hear, I need help paying this bill, and we gave the phone number. We're having conversations, as Jackie mentioned. We are trying to understand what's going on so that we can provide as many resources to address the caller's most urgent needs and identify just opportunities to sort of arm them with information and empower them to move forward whenever possible. We also gather some data like military affiliation and whether the callers have children in their home. And we've shared that here just because it's interesting to see how many folks in those scenarios are calling 211 on an annual basis. And we do have, some additional resources for folks that have military affiliation or that have children We ask for age because we have some age specific resources. So again, we are really trying to provide a comprehensive approach to what we do so that we can provide not an overwhelming amount of referrals, but a good number of referrals to folks so that they have what they need to address whatever challenge they're facing. Jackie's going to talk you through some of our top 5 referral categories. These account for about half of our call volume. So I'll pass it over to Jackie to go through some of those topics.
Thanks. Yeah, you made some great points about the referrals. So out of those 109,000 referrals, certain calls tend to fall into our top 5 each year. So you can see our top calls from 2024. So tax organizations and services were our top call for that year. They usually do fall right near the top. As Heather explained earlier, we schedule the free tax appointments for qualified individuals. And then those calls also include rescheduling appointments and any other tax-related inquiries. Substance use disorder is another top call. These refer to our transfers to the doorways and referrals for any other SUD-related resources. Housing and shelter include referrals for low income and senior housing, rental assistance, homeless shelters, and any other housing related resources. Utility assistance is any need for utility. So this could be electric assistance, heat, internet, phone, anything that has to do with utilities and payments for those. Community action partnerships are a common referral for the utility needs because they have a variety of different programs that help people in those situations. And lastly, individual and family support services refers to our referrals to street outreach programs and case management resources. So on that note, I'm going to skim through some data points of some of the referrals that we've made for 2025 so far. While you view those, we'll take you through some examples of calls that we've received this year. So Heather, do you want to start us off just by explaining what happens when someone calls 211?
Sure. So whenever someone calls 211, we are beginning with a warm greeting. We try to keep our phone lines open so that there is a minimal hold time. I would say our average hold time is less than 30 seconds, if any at all. And when our staff answers the phone, they begin with a warm greeting and they ask for some very basic information, including zip code, age, whether the caller has military affiliation, and children in the home. No other identifying information is required. And we just gather those data points so that we can narrow down resources that are available to that caller in their zip code for their age range. And if they have those extra qualifying factors, those resources will populate when we begin searching our database. We just start with a question of how we can help, and we listen. We listen and we don't judge, as they say. We allow space for people to vent if needed. We understand that many of our callers are in a significant hardship situation, and that's tough. And we get that, and we understand that they may not be cheerful or they may not know exactly what they're looking for. So we really try to listen. We ask clarifying questions, and we try to identify what their need is and address any co-occurring needs or provide referrals to resources that they may not be aware even exist in their community. We are there to encourage and support people who are reluctant to receive help. We do hear that a lot as well, especially in recent years as costs have been increasing. We're experiencing more calls from people who have never needed help before. So our staff is there to encourage and help people understand that it's okay to ask for help and let them know that we're glad that they called. And again, we're always taking that holistic approach to try to address as many urgent needs as possible and equip people with the information that they need to move forward. An example of this approach, I'll go through a call that I had recently, the end of the summer. It was a young parent. They called in looking for help paying their electric bill. The stress was coming through the phone line. I could hear it in their voice. And I'm a trained information and referral specialist myself. So is Jackie. We're all on the phones. All of our staff kind of follow the same process. But when we hear someone is stressed, we just give them time to let it out. And we are empathetic and we validate, that it's a hard situation. This caller shared with me that she didn't have any family nearby. She had been trying to call other agencies for help and wasn't getting through. She was fearful about her electric being shut off, but not only that, she was worried about keeping food on the table. She was worried about providing school supplies for her kids that were starting school the next week. So in this conversation, this caller was able to sort of unpack sort of the overwhelm that she was going through. And I was able to identify some resources for her. So I was able to provide her with a referral for utility assistance. But because we had that conversation and she was given some space to vent, I also identified that this would be a great referral or a great opportunity to refer to a family resource center. And again, this is where that information and referral specialist training comes into play. I know my community resources, our whole team knows them. So I know that a family resource center in this case could be a great support for this family. Family resource centers often tout themselves as a family's biggest cheerleader. They're to help and support and celebrate successes and get people to those successes. So I was able to kind of talk through what a family resource center is, encourage this person to connect with them. So this call resulted in not only a bill resource for this person, but a connection to get those school supplies, find some social connections in their community, and hopefully get connected to some ongoing supports. We don't always have the ability to see the outcome, what happens after we're off the line with the caller, but a lot of the times we are really trying to encourage folks to take these resources and move forward with them so that they can get that support that they need. So some calls are like this, that we're really, we're having an in-depth conversation, we're listening, we're trying to identify needs and other potential referrals. And some calls are very straightforward. Some are in between. I'll have Jackie talk you through another call example that might look a little different from this one, just to give you an idea of the variety that we see.
Thanks, Heather. And I know we're getting a little close to time, so I'll just be brief. So essentially the example Heather went through, she identified discovering additional needs for people. But some calls are pretty straightforward, such as like people calling who wanted to be connected to the doorway. In those cases, our team will, offer to transfer them to their closest doorway. They'll get their first name so that they can make an introduction. They'll make sure that they do a warm handoff with the doorway, and that both parties get connected to each other, can hear each other before they leave the call. So that just helps people. We don't want them to hang up because they're waiting so long, or they have dead air happening. They've reached out, they want help, they want treatment. So we want to get them connected as efficiently as possible, in the warmest way possible.
Yes. So like I said, some calls are longer. We're having a conversation. Some are quick and efficient. And a lot of times it's somewhere in the middle. It might be more efficient, but our staff is quick to identify those needs. So there may be some complementary referrals in there as well. I'm sure that you're wondering what happens when we don't have a resource to offer, and that does happen. Jackie, do you want to talk through unmet needs real quick, just so we can kind of get that information out there as well?
Sure. Yeah. So we try to provide as many resources as possible, but sometimes people call in and there just isn't a resource. So for example, car repairs, people need to help pay to repair their car. We just don't have a resource for that in New Hampshire. So what we do is we try to offer resources for other things to help balance and offset that cost. So maybe providing utility assistance, a pet food pantry, help paying for their prescription, anything that can offset the cost of that so that they can afford that car repair. We also document these unmet needs so that we can share it with leadership and hopefully spread the word to partners, and maybe people out there can create a resource one day for that, because it doesn't exist.
Thanks, Jackie. So we've covered a lot today, and if there's one thing we want you to take away from this, it's that you can feel confident in providing 211 as a resource to your employees, but also your neighbors, your friends, your family, anyone that is experiencing a challenging situation, doesn't know where to begin. Give us a call. We'll have a conversation and we'll try to help point them in the right direction. We are there to support a very wide range of needs. Anyone facing a challenge can call us. And in most cases, we can identify some real resources that are available in that person's community. And yeah, thank you very much for hearing us today. If you have any questions, we'd be happy to take them. I know we're limited on time, so try to squeeze in what we can.
Thank you both. Yeah, anyone with a question, feel free to come off mute. You can also submit it at that form if you would prefer some anonymity in your question.
I'd just like to know if this presentation is going to be available afterwards.
Yes, we will share it out with all registrants and our recovery-friendly workplaces. So if you'd like it to go somewhere that is not either of those places, just let us know in the chat and we'll make sure to send it out.
And I'll just clarify that link there at the bottom. You can use that to be brought to our website. You can request to be added as an agency. You can request to update or review your listing. So you can do everything right through that link as well. Or you can just email us directly and we're happy to talk to you.
Any other questions that we didn't get to or you're still curious about? Okay, well, I'm happy to stay on till 12:30 if anyone wants to save their question for after. But thank you so much, Jackie and Heather, for sharing this with all of our folks. I'm really excited to share this out additionally so that the information gets spread far and wide. It was really helpful to see all of the different examples that folks call in for and hear the stories. And thank you for the work that you do.
Thank you, guys.
Thank you so much for having us. And yeah, please send people our way. We're happy to help.
Thank you. And Jesse,
did you see that
Thank
question
you.
from Jesse?
yes.
Yeah, I had microphone issues. We have associates from Hypotherm. We have locations in Washington, Minnesota, New York. We're just curious for other locations. Is there a 211 in other states as well?
Every state has a 211. We're all sort of independently operated by our local United Ways or other state funded orgs. So each one operates a little bit differently. I can't speak to their offerings, but generally the mission is the same. It's information and referral. There's different state partnerships across the different regions of the country, but every state does have a 211. Yes.
Super. Thank you.
I'm assuming with being so close to Vermont, if you guys run into a situation, you can kind of coordinate with like the Vermont 211 group as well.
We would refer someone in Vermont over to Vermont 211 just because they have some different programs available over there. So we do try to get folks to their local 211 if that does happen. That does happen pretty frequently near the border towns.
Yeah, cool. Thanks. Appreciate it.
Of course.
Thank you. And if we don't have any other lingering questions, then I hope you all have a safe and warm rest of your winter. And thanks for being here.
Thank you.